She was 71 years old, a retired seamstress. She had made wedding dresses for 40 years. Her hands still remembered the feel of silk. She came to the clinic because her stomach hurt. Not terrible, just a dull ache right in the middle. She said, "It feels like indigestion. I ate something wrong." Her daughter brought her. The daughter said, "She never complains. She sewed through arthritis. She sewed through cataracts. She never complains." The doctor pressed on her belly. Soft, no rebound, no guarding. He said, "Probably gastritis. Take this antacid. You will be fine." The woman nodded. She thanked the doctor. She went home. 24 hours later, her appendix ruptured. She was in the intensive care unit for 2 weeks. She survived, but her hands, the hands that had sewn silk for 40 years, never held a needle again. Here is what the doctor missed. Early appendicitis does not always present in the right lower quadrant. Sometimes it starts in the middle, and sometimes the belly is soft. I am Dr. Ravi Channey. You are tuned to RedFlagMD. This is case number 5. Today, we talk about the soft belly and why it kills. Red flag 1, pain in the wrong place. The first red flag, pain in the middle of the abdomen, not the right lower quadrant. Why is that a red flag? Because the appendix starts where it starts. In older adults, it often starts in the middle. Here is a trivia. Up to 50% of patients over 60 years old with appendicitis do not have classic right lower quadrant pain. That is from the 2020 World Society of Emergency Surgery Guidelines. The seamstress was 71. Her pain was in the middle. The doctor called it gastritis. It was appendicitis. So what do you do? When an elderly patient has new mid-abdominal pain, you do not say gastritis. You say, "I need to rule out appendicitis," and you rule it out. Red flag 2, the soft belly that lied, the second red flag. The doctor pressed on her belly. It was soft, no rebound, no guarding. He felt safe. Why is that a red flag? Because early appendicitis, before the inflammation reaches the abdominal wall, presents with a soft belly. The appendix is inflamed, but the peritoneum has not yet reacted. That takes time, hours. Here is a trivia. The 2020 WSES Guidelines state that a soft belly does not rule out appendicitis, especially in the first 6 to 12 hours of symptoms. The seamstress had a soft belly and a dying appendix. So what do? You do not trust the soft belly, you trust the story. An elderly woman with new abdominal pain who never complains. That is appendicitis until proven otherwise. Red flag 3, the patient who never complains. The third red flag. The daughter said, "She never complains. She sewed through arthritis. She sewed through cataracts. She never complains." Why is that a red flag? Because older adults often have muted presentations. They do not mount fevers. They do not mount white blood cell counts. They do not mount guarding. They just fade. Here is a trivia. The 2020 WSES Guidelines state that elderly patients with acute abdomen are 2 to 3 times more likely to have atypical presentation and twice as likely to have delayed diagnosis. The seamstress had muted signs. Her pain was not severe. Her belly was soft. Her tests were normal. But her daughter knew. When the family says she never complains, you stop. You do not say, "Probably gastritis." You say, "Tell me more," because the family is your best diagnostic test. Red flag 4, the pain that comes after eating, the fourth red flag. She said the pain came after meals. Not always, but often. Why is that a red flag? Because the bowel needs blood to digest food. If the arteries are blocked, the bowel cramps. The pain comes after eating. The belly stays soft until the bowel dies. Here is a trivia. The 2020 American College of Gastroenterology Guidelines state that postprandial abdominal pain with a soft belly in an elderly patient with vascular risk factors is mesenteric ischemia until proven otherwise. The seamstress did not have mesenteric ischemia. She had appendicitis, but the pattern is the same. Pain after meals with a soft belly in an elderly patient is not indigestion. It is an emergency until proven otherwise. So what do? You ask the question, does the pain come after meals? If yes, you do not say indigestion. You order a CT angiogram. Red flag 5, The word probably. The fifth red flag. The doctor said probably gastritis. Why is that a red flag? Because probably is not a diagnosis, it is a guess. Here is a trivia. The General Medical Council Diagnostic Safety Advisory lists premature closure as one of the top causes of diagnostic error. Premature closure is when you stop thinking too soon. The word probably is a marker of premature closure. The seamstress did not have gastritis, she had appendicitis. If the doctor had said, "I need to rule out," instead of probably, she would still be sewing. So what do? You ban the word probably from your clinical vocabulary. You say, "I need to rule out." You do not guess, you prove. The patient's perspective. What she felt, what she said, what she hid. Now let me take you inside her mind, because this is where the real tragedy lives. She was a seamstress. She had spent 40 years measuring, cutting, pinning, sewing. She had made wedding dresses for brides who were nervous, excited, tearful. She had held their hands and said, "You will be beautiful." She was not a complainer. When her hands hurt from arthritis, she sewed anyway. When her back ached from bending over the table, she sewed anyway. When her eyes blurred from cataracts, she sewed anyway. Because that is who she was. So when the pain started in her belly, she told herself, "It is nothing. I ate something wrong. It will pass." She did not want to be a burden. She did not want to make her daughter worry. She did not want to be that old woman who goes to the doctor for every little thing. So she waited. The pain got worse. She still did not complain. Her daughter noticed. Her daughter said, "Mom, you are not fine. I am taking you to the doctor." She went. She sat in the examination room. She wanted to say, "Something is really wrong. I have never felt this before." But the doctor was busy. The clinic was crowded. He pressed her belly and said, "Soft." He ordered a blood test and said, "Normal." He said, "Probably gastritis." She wanted to argue, but she was tired, and she was 71, and she thought, maybe he is right, maybe I am overreacting. So she nodded. She thanked him. She went home. 24 hours later, she woke up screaming. Her daughter found her on the bathroom floor. Her appendix had ruptured. In the intensive care unit, she looked at her hands. The hands that had sewn silk. The hands that had held brides. The hands that would never hold a needle again. Here is what she thought. I should have said something. I should have told him how much it hurt. I should have made him listen. But she did not. Because she was taught to be polite, to trust the doctor, to not be difficult. And that politeness, that trust, that silence cost her everything. So here is what you need to understand. Your patients are not always telling you the full story. Not because they are lying. Because they are afraid. Afraid of being a burden. Afraid of being difficult. Afraid of being wrong. You have to ask the right questions. You have to notice the daughter with her arms crossed. You have to see the hands that have worked for 40 years. You have to listen to what is not being said. How the lawyer will destroy this case. Now let me tell you how the lawyer will tell this story to a jury. The seamstress was 71 years old. She had sewn wedding dresses for 40 years. Her hands had held brides on their happiest day. She came to the doctor with abdominal pain. Her daughter brought her. Her daughter said she never complains. The doctor pressed her belly. It was soft. He ordered a blood test. It was normal. He said, probably gastritis. He sent her home. 24 hours later, her appendix ruptured. She survived, but her hands never held a needle again. The lawyer will hold up her hands, the hands that sewed silk, the hands that are now still. He will say to the jury, this woman trusted her doctor. She told him she had pain. She told him it was different. Her daughter told him she never complains. And what did the doctor do? He guessed. He said, probably. He did not order a CT scan. He did not admit her for observation. He did not call a surgeon. He sent her home to die. The lawyer will then read from the 2020 WSES Guidelines. Up to 50% of elderly patients with appendicitis do not present with classic right lower quadrant pain. A soft belly does not rule out appendicitis in the first 6 to 12 hours. He will turn to the jury and say, the doctor did not know this, or he knew it and he ignored it. Either way, the seamstress paid the price. The jury will not care that the belly was soft. The jury will care that the doctor did not listen to the daughter. The jury will care that the doctor said, probably. The jury will care that a woman who sewed silk for 40 years cannot sew anymore. So what do you write to protect yourself? Not just belly soft, no rebound, no guarding. You write this: 71-year-old female with new mid-abdominal pain. Daughter reports patient never complains. Belly soft on exam. However, given age, atypical location of pain, and family concern, early appendicitis remains possible per WSES Guidelines. Plan: CT abdomen and pelvis. Surgery consultation. Safety netting provided. That paragraph is your shield. It shows you recognize the red flag. It shows you followed the guidelines. It shows you listened to the daughter. It shows you did not guess. It shows you did not say probably. And it shows the court that you cared. Why do we miss this? Here is why we miss it. First, a soft belly creates false reassurance. Second, you rely on textbook presentations. Third, symptoms seem non-specific. Fourth, elderly patients have muted signs. Fifth, time pressure pushes you to guess. Here is a trivia. A 2019 study in the journal Surgery found that delayed diagnosis of appendicitis in elderly patients was associated with a threefold increase in perforation rate. The seamstress waited 24 hours. Her appendix ruptured. Her hands never held a needle again. These are not excuses. These are red flags. What you will carry home. You will carry the seamstress. You will carry her hands. The hands that sewed silk for 40 years. The hands that never held a needle again. Pain in the middle of an elderly abdomen. Not gastritis. Appendicitis until proven otherwise. A soft belly in early appendicitis. Not safe, dangerous. A daughter who says she never complains. Not a bystander. Your best diagnostic tool. Pain after meals with a soft belly. Not indigestion. Ischemia until proven otherwise. The word probably. Not a diagnosis. A guess that kills. Do not miss them again. The guidelines say 50% of elderly appendicitis presents without classic pain. The trivias say delayed diagnosis triples the perforation rate. The daughter said she never complains. The doctor said probably. The seamstress lost her hands. Do not be that doctor. If this episode taught you something you will carry into your practice, share it with a colleague who needs to hear it. Like this video so more people can find it. Subscribe to RedFlagMD so you never miss another checklist course. This is Dr. Ravi Channey. You have been tuned to RedFlagMD. I will see you in the next one. Take care.